Good afternoon, North Dakota. Grateful for all of you tuning in. And if you're listening and watching here today, you're part of our path forward. We've talked from the beginning about we've got to do two things simultaneously, and that's save lives and save livelihoods. And all of you are helping us advance towards a better, safer, healthier future post-pandemic. So thank you for that. We have a lot of topics to cover today, including an update on how we get all of our important higher education institutions and all of our students and faculty and staff safely working again. So I want to thank North Dakota University System Chancellor Mark Hagerott, who's here today, and as well as a State Board of Higher Education, the student member, Erica Solberg, is here today. So thank you for joining us. She's a student at NDSU, Go Bison, and they're going to both be speaking later today to share information about back to university testing statewide. The first topic that I want to take time to lead with some gratitude is I want to express gratitude for all the work that went into yesterday's action by the Emergency Commission to approve a third tranche of federal funding to support the state's COVID-19 response. As I think most people now know, that when the pandemic first hit last spring, the federal government and the administration moved quickly. The coronavirus relief funds were sent out as block grants to each state based on a formula. North Dakota received $1.25 billion, and those were dollars could be spent on things related to the pandemic. For expenses that occurred after March and before December 30th of this year. There was other sets of restrictions on how the money could be spent, but roughly it was, again, a block grant of emergency funding to be spending on things related to or individuals, businesses that were affected by the pandemic. And over the last months, we've worked very closely with the legislature, including both the majority and the minority leaders, to help shape how these dollars were spent. Each state in the nation had their own set of challenges about how to take this emergency funding and deploy them quickly, which was also part of the point of the federal funding, was to get the dollars spent quickly to help revive the economy and to help save lives. Yesterday, the meeting of the Emergency Commission met, and that Emergency Commission reviewed and approved yesterday another close to $320 million of federal funding. It was the third tranche of approvals, but those proposals, of course, came from dozens of different agencies and other elected officials. Tremendous amount of work went in by Joe Morissette and the team within our OMB to review those to make sure that they fit federal guidelines and that they were not in the existing budgets prior. And so again, with the commission yesterday approving these, they will advance and be on the agenda next week for the legislative budget section. But I want to review that and again thank all those that were involved in this. Part of what got approved yesterday was $100 million more for the State Unemployment Insurance Trust Fund. We've talked a lot at these briefings about the importance of unemployment insurance for people that were displaced by the pandemic. We were one of the states that had the lowest unemployment in the nation. Pre-pandemic, we're still one of the lowest. I think the latest result for June was about a 6.3%, so far below where the national average is, and there are still positions open and unfilled in North Dakota if you're looking for work, but we have made sure that our unemployment insurance fund, the unemployment insurance fund, is generally supported by taxes paid by businesses that create jobs. And so by placing the coronavirus relief funds into the unemployment insurance fund to keep that liquid and keep it solvent allows us to keep paying weekly all of the what we've paid out in hundreds of millions of dollars that have been paid out in unemployment to supplement what would have been people's paychecks prior to the pandemic. So again, I want to take a special note on that because this additional $100 million, which was approved yesterday, brings to over $400 million of the $1.25 that's gone into unemployment. So again, that's direct support for individuals who've been affected by the pandemic. And I also want to say, too, that other states have, rather than spending their coronavirus relief funds on that, have been borrowing money to help keep their unemployment funds solvent. So again, in North Dakota, being the conservative folks that we are, we're using this direct expenditure to keep that unemployment insurance healthy. We also included in this another $96 million for public health, and this includes all aspects of everything that we've talked about here at these meetings, but that will be dollars that can be spent now through the end of December to continue our campaign against the COVID pandemic. Yesterday, $59 million went in to support cities and counties to help pay for local law enforcement costs, which is a federally approved use of the coronavirus funds. And so after it goes through a budget section, then those dollars will be sent out to cities and counties across the state. And so again, great work by the entire group that went into this thing. When we take a look at the coronavirus relief funds in the form of a pie chart from the beginning with the 1.25, this pie chart looks different than other states. 24% of this has gone towards public health and safety, and some of that public health includes dollars that went towards making sure higher education is prepared for the 45,000 students to resume their education this fall. The 12% that you see there for the continuation of government services, that's for every aspect of government, not just public health, but all the things we do from game and fish to parks and rec to the Department of Transportation, building roads, everything that we're doing. The judicial branch, the legislative branch, all three branches in there in terms of keeping government going, serving the citizens of North Dakota. Human services, I mean, you name it, it's in that bucket. But when you take a look at the other two big pieces of this pie chart, economic support for individuals, that's the $400+ million primarily that occupies that third of the pie chart related to unemployment insurance. But then again, what's unusual for North Dakota is that through the Bank of North Dakota, the Commerce Department, the Ag Department, and many others where we've had grants that are going out, that we've had support for businesses. And this is an important part. Because you've all done your part to help slow the spread of the coronavirus, the state of North Dakota has been able to spend dollars not just on public health, not just on continuity of government, but we've been able to spend it on economic support for individuals and for businesses. So I think when we talk about saving lives and livelihoods, you can see here that at least 2/3 of the spending has gone towards the saving livelihoods portion of this, while we continue to really focus on making sure we're doing a great job of having some of the best record from a health standpoint as well compared to other states. I want to especially thank majority leaders, which Senator Rich Wardner and Representative Chet Pollard. We've been in contact with them as well as minority leaders, Senator Joan Heckerman and Representative Josh Boucher. Our office has been in weekly contact with these leaders, regular conversations involving their respective caucuses to get input, and dozens of other individual legislators that these leaders have referred us to get specific input about the programs that we've put together and supported. So again, to the legislature, we say thank you. To everybody involved, we say thank you. Again, North Dakota very effectively deploying these emergency relief funds that were a part of the federal response. Getting into the numbers, which we normally do, we want to start off with a new slide. It's done for each of you to sort of say, you know, what's the state of North Dakota really focusing on as they're managing this pandemic? And the first thing, of course, that we take a look at is active confirmed cases, because that really represents, well, it's just a numerator. It does represent a indicator of future activity. When those active cases go up, depending on the age and underlying conditions, that can lead to be a leading indicator of where pressure we may have in hospitalization. It also gives us a sense of how much work public health has to do in terms of contact tracing, because each active case on average may have come in contact with 5 or 6 others, and so we need to contact the individuals and try to get those individuals either isolated or tested as we work to sort of track this virus down and slow it down. Another number we look at very diligently, and I'm sure all of you, which is by epidemiologists called the point prevalence, or the daily positivity rate of 2.5%, is what it's been over the past week. We had 800 new cases with over 30,000 tests completed in the last week for a 2.5% test. We also take a look at recovereds. When recovereds are greater than new cases, then actives drop, of course. When they're, in this case, when they're slightly below new cases, then active cases climbs. The 1111 active cases is a new high for the state of North Dakota, but we're very encouraged that the number of recovereds here almost equaling that. And again, the challenge to everybody in North Dakota, because we can all do our part to help slow the spread. If we slow the spread, we can get actives climbing actives climbing more slowly than the recovereds, and then we'll see the active cases decline. Another thing we take a look at, of course, hospital capacity, 51 people currently hospitalized, and that is still well within our capacity to be able to manage that from both a hospital bed and staffing and ICU standpoint. When we take a look at the cumulative hospitalizations, we've done a great job as a state in only utilizing effectively single-digit percentages of our overall hospital capacity. But if you take a look at the large blip that we had a week ago and then the drop that followed, I think we sent out an explanation after that. There had been a little bit of a lag in terms of processing discharge data. And so the previous high that we had in the 50s, that was our all-time high for hospitalizations, we believe was an overstatement in the data. So I'm taking a look at this 51 today, which is we've confirmed is a hard, fast number that's been reconciled every day. So we may be approaching, in my mind, our record hospitalizations right now, given that previous high could have been a data lag error. But so this is, again, we see hospitalizations increasing. That gives us some concern, but we have a lot of capacity left to go. In terms of the last 7 days of testing, as I mentioned, to get to that 2.5, the numerator on that, 800 positive cases, the denominator, 365,000 tests that were completed this week. Again, thanks to all the folks that were involved, the health professionals and the lab team, for processing, again, nearly a record number of tests within 7 days. There's been questions about positivity rates. Different websites around the nation use them. I want to, again, share with everybody in North Dakota so they're clear about our data that this number, the 2.5%, the point prevalence rate, or the daily positivity, is calculated using the exact same formula that the CDC COVID data tracker uses. And this is the official number. You take the total number of positives you have over the total number of tests completed, whether that was someone who'd been tested once before or twice before or 3 times before, if it's like someone who works in healthcare. What matters is what is the prevalence of the disease today, because a COVID test taken a month or 2 months ago is not relevant. We want to know where we are today. And as of today in North Dakota, over the last 7 days, we're averaging 2.5% positives. And that is, we go to the next slide when we talk about the serial testing. This was 800 positives over all the tests taken in the last week, which is about 32,000 tests. And those tests have a mix of tests of people who've been tested once before or multiple times before, and people that are new. In the gray area on the slide on the bottom, or the darker shaded area, represents new individuals who had not been tested before. Serial testing really matters in long-term care, and when we take a look at the long-term care cases, again, one of the great success stories we had early on when we had a explosion, if you will, of cases that was happening in long-term care, that dropped dramatically. We've been able to hold that down, and now, as we expected, when we started adding back visitation and other things, we were adding some risk back into the system, and we're again seeing a rise in cases. Happily that it's we've seen a little bit of decline in the last few days, but again, the blue here is active staff. We don't want to see anyone get COVID, but if it's a choice between a staff and a resident, staff generally younger and healthier and are better able to manage. So the blue represents staff. Active residents there, we've got 55 staff. Those folks are all isolated. 27 resident active cases in long-term care, and again, we want to see that trend continue. Residents continue testing on average at a lower positivity than staff members. That makes sense because the staff members are out in the community, but we all must keep working to keep COVID-19 out of our facilities, which house some of our most vulnerable citizens in the places that they call home. So if you are planning on visitation, again, encourage people when you're there to make sure you're masked up, you're following all the important protocols on distance, and of course, if you're feeling well or at all symptomatic, please, whether you're a staff or whether you're a visitor, please stay away from our most vulnerable citizens until you have an opportunity to either confirm that you're negative or feel better. When we take a look at the overall rate in COVID-19, again, this is the cumulative number of positives since the beginning of the pandemic, since our first case on March 11th, divided by the number of individuals tested in North Dakota. Again, we've done over 300,000 total tests. About half of those now, 160,000 of those have been in number of individuals. And we take total cases divided by individuals. We're at the 4.3 cumulative in terms of the number of North Dakotans who've been tested who came up positive. When we take a look at the rolling average, again, this is another thing that we're taking a look at as we go through this. We are seeing, again, on the white line here, this is North Dakota. The Cass County, which was our concern area early on, is now not only flattened, but is now below the state average. And Burley Morton, where we have the most number of active cases, is the yellow line that's going up. One of the things that we've talked about when we talk about positive and negatives is, of course, we showed on a chart earlier that we're now up to 107 deaths. That's an increase of 6 over the past 7 days. A woman in her 80s in Cass County with underlying health conditions, a man in his 80s in Burley County with no underlying health conditions, a woman in her 80s in Ramsey County, which would be up by Devil's Lake with underlying health conditions, a man in his 70s in Grand Forks County with underlying health conditions, a woman in her 50s from Burley County with underlying health conditions, and then 2 more, sadly, deaths today, a man in his 60s from Griggs County with underlying health conditions, and a woman in her 70s from Sioux County with underlying health conditions. And as always, our hearts and prayers go out to the family and friends who've lost a loved one during this pandemic. Going back to the case rates here on the positive, where we see Burley climbing faster than the rate. As you know, we announced that we put together a task force that's working, and this is again an area of activity that we want to focus on. 344 of the state's active cases right now are in Burley Morton, and that's slightly close to 30%. 210 of the 800 new cases in the last week, over 25% were in Burley Morton. So I'm glad the task force is up and running. The goal of that task force is to bring the positive rate in line with the state average quickly, so they can duplicate the success that we had with the Red River Valley COVID-19 task force in Cass and Clay counties. We now have a steering committee in place for the Burley Morton task force, and leading this effort will be Renee Mock from the Bismarck Burley Public Health, Aaron Arata, administrator of Custer Health, which manages Morton County and several more counties to the west, Tammy Miller, the chief operating Officer of the state of North Dakota, Bismarck Mayor Steve Bakken, and give a shout out to Mayor Steve for the encouraging posts he's put out on mask wearing today. Thank you for that, Mayor Bakken. Cody Schultz, Morton County Commission Chair, who also serves working for the state of North Dakota leading our Department of Emergency Services, and Vern Dosh, who's a renowned business leader, retired here from Bismarck, but who's been helping the state on contact tracing. He's the administrator for the state of North Dakota. So we've got a great team of public health and other leaders here, elected and otherwise, to help lead that. Other members at large include the Mandan Mayor Tim Helbling, Lincoln Mayor Gerald Wise, Burley County Chair Jerry Woodcox, and there's 5 subcommittees, and they'll add additional stakeholders to each of these. One subcommittee will be focused on healthcare, testing strategy, and contact tracing. Another will focus on educational institutions and activities. A third will focus on underserved populations and wraparound services. Another will engage the business community, and a 5th subcommittee will work on public education and awareness. The task force has been getting organizing. They've got their kickoff meeting for the full task force on Friday, and they'll continue meeting virtually as we work to reduce the positive rate across these 2 counties. So again, thank you to all these leaders and all the volunteers that are jumping in to help us to bring the Burley-Morton numbers down to at or below the state rate. When we again take a look at the state chart, and you can see there, the darker the color, the more number of actives. One other area of focus that we're giving attention to today is in the counties, both in Ransom and in Benson counties, and these are an area that encompasses Devil's Lake, a very popular summer tourist destination. It also encompasses the Spirit Lake Reservation, and it's emerging as another area of concern. And today, of our 149 positives that we had today, 46 of those came from those 2 counties, Benson and Ramsey. Part of that uptake, I'm sure, was related to the large testing event that we held on Friday at the Chandeska Chicana Community College in Fort Totten. 977 tests completed. When we do these large testing events, we do tend to identify people that may have been asymptomatic, which is part of our strategy, because we want to identify people who might be spreading this disease but not even feel any symptoms, because if we can identify those asymptomatic individuals and have them isolate, we can definitely stop the spread. Usually if someone is feeling sick, sneezing, coughing, upper respiratory issues, they generally tend to stay away from people. So, let's say even by their own volition, people when they're sick tend to stay home. But in this case, with this interesting thing with COVID, where you can be asymptomatic and be a spreader, so these testing events really matter. Spirit Lake, in response to this, the Spirit Lake Nation implemented a mask mandate last week, and they've imposed a 10 p.m. to 6 a.m. curfew, and they've got a stay-at-home order for those who've tested positive. I want to thank Chairman of Spirit Lake Nation, Doug Yankton, for the leadership that he's providing, and also Scott Davis, who leads Indian Affairs for the state of North Dakota as part of our cabinet. They've been working closely together, and as we have with all 5 of our tribal nation and tribal nation chairs, thanks to all of them for their leadership. And we'll be scheduling another call with all the tribal leaders soon, but we're working closely to make sure that Spirit Lake has everything they need, including an appropriate number of masks for use to help slow the spread. When we take a look at, again, we've talked big numbers here in terms of federal dollars that we're putting in to try to address this pandemic. But again, it's important to remember that the actions that we take as individuals are probably the most important thing in terms of slowing the spread. And it's pretty simple. This virus lives in us as human carriers of that virus, and so if you keep distance away from other people, generally 6 feet of distance, you're not going to either receive or transmit. If you can't keep your distance, then wear a mask, washing your hands frequently, avoid touching your face, clean and disinfect surfaces. But again, all of these things matter, and again we see lots of lots of pictures online, lots of reports of people that aren't appropriately social distancing in all kinds of settings. That doesn't, it can be whether it's sporting events or bachelorette parties or other events. It can be anything from a funeral to a wedding dance to a church to a birthday party to a summer prom, whatever it is. There's risk occurring there. And so again, we would ask people again, if you're to avoid these situations if you've got any concerns about your own health. And again, if you can't keep a distance, think about wearing a mask. If you see someone wearing a mask, tell them thank you, because they're protecting you as well as themselves. And again, so let's keep being North Dakota smart and watch these numbers decline. I would say again, relative to the rest of the nation, we're among 16 states that have a less than 5% positive rate. It's great to be at the 2.5 for the last 7 days. So we're in the right half of the best half, if you will, in terms of low positivity rates. But we want to stay there. We want to keep it there. That's the way we're going to get our kids back in school. That's the way we're going to get our universities open. That's the way we're going to get our businesses back thriving again, is by managing and being smart about how we approach this pandemic and not giving it a chance to spread. One of the things that we know is very important, of course, to our economy and to the future of our state is higher education. And as we move towards reopening our colleges and universities this fall, the safety of the entire campus community remains a top priority. I want to thank our Dr. Wynn and all those that are serving on the North Dakota Smart Restart group for higher education. And we're grateful to the faculty and the staff who are committed to continuing to educate our young people during this pandemic. Again, it's our priority to protect the health, the safety, and well-being of everyone, the staff, the faculty, and the students. And a big part of our strategy is getting tested, and getting tested before returning to campus will help ensure not only that the students, but families, friends, our communities where our university reside, and that all the loved ones can remain healthy and safe as possible. And we're going to hear first from University System Chancellor Mark Hagerott, then Erica Solberg, the student representative, but I'd like to welcome both of them here today. And I want to also thank them for all their leadership, the two of them, and what they're doing to help us prepare for a safe restart this fall. Chancellor?
Well, thank you again, Governor, for taking this time to talk about students. And thank you for the press for being here. I know you're on the front line of this too. One of the questions that come up is, why don't we just stay online and not go back? And the reality is we proved that. We could do that, but there really is some benefits of being on premise for especially undergraduates and people who've got to work with their hands and be in labs. So as you know, your university system is on the front line for helping unemployed people get retrained, basically diversifying the economy, student health, and then producing lab techs, nurses, doctors. So there's reasons for us to do this calculated smart restart. But to do so, we've got to thank a lot of people, and to take some of the governor's points, to thank him again for the money the Emergency Commission and he helped ushered through yesterday will help our campuses be safer, cleaner, so that the faculty and the staff and the students can return, again, with managed risk. And so I do want to thank the faculty, because I know they'll be on the front line doing this. But because of the technologies we have and the money we have, we do have the ability to protect certain faculty members should they need to teach from a distance. And again, it's a blessing that we are a system of young people who have a lot of resilience in the face of this. So the board has encouraged the campuses to go back. But we know each campus is different, so even though we do have the Smart Restart Task Force, each campus is working through how best to implement that. But one thing that is common across all that are the students. And we will be having, at the same time the K-12 students are coming back, we will have tens of thousands of students beginning, almost that migration we think of, birds moving north to south. Well, now it's going to be students heading to campuses. And so to try to knock that R0 factor down, the governor alluded to it, but that's what we're trying to do is mathematically knock down that R factor, and by having pre-testing and then testing when you're on campus, and then serial testing and doing the things the governor mentioned, distancing, wearing masks when you need to, washing your hands, disinfect surfaces. Each one of those things keeps knocking down that R factor. And as I said before, as a former military person, it is, a war against a virus. And we think we can win this thing by all doing those things. But the most crucial thing is having the students being engaged really soon on the testing. And if there's that slide, I think we've got this slide coming up, that I want to thank the Department of Health and Vern Dosh, that they are supporting us in just wonderful ways, and you'll see on the chart there, all the locations are going to make testing available, because we realize if we made this too hard for students to try to get tested before campus return, we would have a lower participation rate. So this has just kicked off in the last day or so, and will continue until students return to campus. And you can see on here, there are many, many locations where it's an easy drive to get there. In some cases, they'll be right there on the campuses when you're returning. But hearing me talk, and you've heard me talk many times, is one thing, but hearing student leaders talk, because the students really own this. I would challenge our students that we want the healthiest campuses in the country, that if there's a state that can safely do this, I think it's North Dakota. And so I would like to introduce briefly one of my bosses. So those who understand, we have a state board made up of many wonderful, older, knowledgeable people, but the wisdom of many generations ago, they required students to be voting members with as much authority as Dr. Ryan, who's a former CEO of a medical system. So Erica Solberg is, as the governor said, at NDSU. She is our voting member, and she and the other student leaders are working up some great ideas to help maximize student leadership. And so, Erica, I think I'll turn it over to you, and you can make your debut here. So.
Good afternoon. Again, my name is Erica Solberg, and I'm the student representative on the State Board of Higher Education. It is my distinct responsibility to be the voice of students in higher education policy decisions, and I feel very honored to be addressing you today on behalf of students attending North Dakota higher education institutions this fall. Thank you, Governor Burgum and Chancellor Hagerott, for this opportunity. On behalf of the North Dakota University System students, I would like to express immense gratitude to the faculty and staff that have been committed to educating us during this pandemic. We know that this year has been extremely difficult for everyone, but we want to especially acknowledge our professors and staff who have been working diligently to ensure that we can return to campuses and, for those incoming freshmen, begin their journey in higher education. We love our professors, and we want them to know that their efforts have not gone unnoticed. We appreciate you. I also want to express how excited we are to get back to a sense of stability and normalcy in a world that has been filled with many unknowns. I know our campuses won't look exactly like they've had in the past, with implementations of hybrid classes, as well as the necessary precautions that have been implemented, including physical distancing in classrooms and masks when physical distancing can't be possible. We still appreciate the opportunity to be together, to learn from one another, and to be part of the campus community. Those whom I've spoken with are very excited to return to campus with their friends, beloved organizations, and continue on their education journey. I know that each campus has their own policy on mask wearing, and we want faculty and administrators to know that we are committed to the safety of our campus communities and professors. While as students, it may not be the most convenient thing to do, but if it will protect our communities and professors and keep our campuses open and in person, then it is definitely something worth doing. The free COVID testing that started yesterday and will go through August 25th are very much appreciated and provides us an opportunity to know as students that when we go back to campuses, that we are not going back to harm vulnerable populations on our campus communities. As an individual, I encourage all of my peers to take the opportunity to become tested in their community. It's free, and it'll probably be the easiest test you take this year. To my fellow students, I am proud of you. This is not an easy time to be going back to college. We have dealt with the stress, sadness, and unknowingness of what is to happen next. And yet, we have dealt with this time with great fortitude and courage. Our great state and higher education institutions have strong ties to the pioneers. These pioneers weathered floods, drought, famine, and yes, the ever-blowing wind. Despite the challenges they faced, they always kept their end goals in mind to build a better future for themselves and those around them. So as we move forward with the challenges we're going to face on campus, may we keep the pioneer spirit with us, that no matter the obstacles, we must keep going because our end goals and dreams don't stop unless we do. Thank you.
Thank you, Chancellor Hagerott, and thank you, Erica. Great to have you here with us today in person. And again, thank you for serving on the State Board of Education. Thanks for doing that while you're going to school and while you're helping all the other student leaders help us navigate through these incredible times. So both Erica and Chancellor Hagerott will be available for questions following, and I'm sure those of you here will want to take advantage of that. Next topic is the economic resiliency grants, which we announced last week. As you know, these grants provide funds to companies operating in North Dakota for business improvements to help restore consumer confidence in the marketplace and help reduce the spread of COVID-19 in our communities. Businesses can apply for grant funding up to $50,000, up to $100,000 for businesses that operate in more than one location in North Dakota for direct investments to reduce COVID-19. The more information about what can be eligible as you start thinking about your plans can be found at ndresponse.gov under COVID-19 Business and Employer Resources, and the applications for the first round will be made soon, as in the website where the online applications is targeted for delivery next week, and they'll be processed on a first-come, first-served basis, so stay tuned for more information under the Commerce or the ndresponse.gov websites as that continues to get ready to be launched. Next topic is again one we've talked about before, but it's an important one. The census, we've talked in the past about the great job that some of our communities have done with getting their numbers in spite of the pandemic. We've had some communities in North Dakota that have reached 100% of available people already completing their census forms. But if you are in North Dakota more than 51% of the year, then you count in North Dakota, more than 51. So whether if you're a snowbird, if you're an infant that was born just before I guess be July, like end of June this year. If you're an infant that was born in the first half of the year, they would be living in North Dakota for 51% of the year. So we want to make sure that everybody counts. Our response rate right now as a state is 62%, which is below the national average, and it's lower than our 2010 average. That's not a good thing because we have 150,000 households that have not yet responded to the census. That could cost the state nearly $725 million in lost federal funding. So if you want to do your part in helping make sure that North Dakota gets its share of all kinds of formulas that are out for, in whether the health or human service formulas are often built around census, and that goes for the next 10 years. Just 1% of households missing in North Dakota could cost us almost $70 million in funding. And so other places, again, where we want to focus on our most severely undercounted areas are in the rural counties, western counties, and in places where our counties overlap with our sovereign nations. And so Rolette County, the response rate 30.5%, McKenzie County, response rate 31%, Sioux County, response rate 32%, Montreal County 34%, Benson County 35.7%, Divide County 39.7%. So again, participation matters, and when you help respond, you're not just helping the state, you're helping your community, whether it's federal funds for a local school, local hospital, local roads, public works, and other vital programs. And so again, these are affect programs such as National School Lunch Program, Head Start, Special Education, Pell Grants, Supplemental Nutrition, Child Care and Housing Assistance, etc. To take the census and to do it today, simply visit 2020census.gov. If you don't have access to be able to get on a device, to get on the internet to 2020census.gov, you can also respond by phone at 844-330-2020. It only takes a few minutes. It's confidential. The data is held separately from any other government agency. And so again, please participate, help do your share for North Dakota. Next item, some of you in the media have already reported on this, but we wanted to put out a sort of a statewide public service announcement on behalf of the North Dakota Commission of Agriculture, Doug Goring. We know that reports have made of North Dakotans receiving unsolicited in the mail packs of seed, which they have not ordered and may not know where they've come from. If you or anyone know who's received a package of seeds, please do not plant them. They might be invasive to North Dakota. They might introduce harmful diseases or toxins that would be harmful to plants or livestock. Instead, keep the seeds and the packaging and the mailing label and contact the North Dakota Department of Agriculture to fill out a brief survey online at nd.gov/NDDA for North Dakota Department of Ag, and look for the header or / unsolicited seeds. North Dakotans who've received unsolicited seeds can request a prepaid envelope to mail the seeds to the Ag Department, who is working with the USDA to identify and properly dispose of the seeds. Again, thank you, Commissioner Goring, and your team for acting quickly to provide proper recourse for our citizens to protect our important ag industry and all the plants and wildlife in our state. Next topic, as we've always had, is a behavioral health update. And we know starting a new school year, as Erica just said, it can be stressful even under the best of circumstances, but certainly under a pandemic, all this uncertainty creates additional stress. And some of the best ways, whether it's to support your adult children or to support your young children that are heading back to K-12 through another transition, is to engage in open communication, and then you yourself as an adult be a role model of healthy behaviors. The Behavioral Health Division has a new resource available to help parents in supporting children with back-to-school plans, and whether that means returning to school full-time, distance learning, or a hybrid model. Parents can find resources on preparing your child for the faces they could face when starting school this fall, which could be that schedules are different, or they might have distance seating or eating places, or hybrid schedules, or mask requirements. Assuring them that all of these measures are kept in place to help keep everybody healthy, and finding out as much as possible about what the school has planned so you can prepare your kids and yourself. And again, this varies at a district by district level, because in North Dakota at K-12, the districts are announcing their own start dates, their own back to school plans. So contact your local district, outline as best you can what their new daily routine will be and how the drop-off and pickup will go. Practice washing your hands together with your young children and applying sanitizer. This is going to be even a bigger part of their daily routine, and you can teach them how to do it and do it well. And talk to them about the positives of attending school, however that looks, emphasizing the importance of flexibility. You can help your child identify strategies to remain healthy, which can help provide a sense of control and reduce feelings of anxiety. And of course, always with your kids, encourage your children to vocalize their thoughts and feelings, check in with them regularly, and give them a safe place to share what they're thinking and feeling. Remind your child and yourself that school will be doing everything it can to keep everybody safe. Where do you want to find out about this? Of course, it's at parentslead.org for this information and more. And thanks to all the parents for all you've done working to ensure students are prepared for this school and being a great role model of being North Dakota smart. And a reminder for parents that might be stressed out by all of this, free and confidential crisis counseling services are available to all North Dakotans, 7x24, no cost, totally confidential. If you need to talk to somebody about anything, projectrenew.nd.gov or call 701-223-1540. On the good news section for today, North Dakota Council of the Arts, like many organizations, has been disrupted by the pandemic, and they've altered a number of the current programs they were doing to ensure that art remains central while maintaining social distancing. Their efforts for the North Dakota Council of Arts have kept artists going, employed, creating art. They've kept seniors engaged. They've kept families and communities involved. So I want to thank everybody at the North Dakota Council of Arts for their great work. An example of some of the work they're doing is with the support of the council. Artist Melissa Gordon created vibrant chalk drawings and window paintings based on resident requests at Prince of Peace Center in Allendale and at the Good Shepherd Home in Watford City, among others. These projects help foster connections, conversation, and memories among staff and residents who were fighting to maintain connectivity during this time of isolation. When COVID-19 changed live collaboration, artists in residence with Council of Art Nicole Gagner kicked into high gear. With her scheduled art classes and activities indefinitely canceled, she transitioned into using digital formats for teaching and engaging on art. And though she went into schools for a week of, just what she usually did, a week of hands-on immersive lessons, she adopted her methods for interaction without losing the objective content and personal encouragement. With the help of school, students were able to safely pick up art kits using YouTube Live. She engaged 75 fifth grade students in lessons, drawing designs and constructing three-dimensional cities. These are just two ways in which many of the ways that North Dakota Council on the Arts has continued to promote art in the community. In addition, they have gathered many creative online art projects and activities from North Dakota artists and arts organizations to share with you and your families. You can see all of those at arts.nd.gov for ideas and for inspiration. In closing out, in gratitude, a quick shout out and then a quote. The shout out, of course, goes today to the White House. Yesterday afternoon, the White House followed the lead of 42 of the nation's governors who had requested the extension of Title 32, which is a federal capability that allows the coverage from the feds to support the authorization of National Guards assisting in fighting COVID-19. It's doing that now, been extended through the end of the year, with the federal government picking up 75%, states picking up 25%, but this saves tens of millions of dollars for the state of North Dakota in terms of our great National Guard team. We've had anywhere between 250 and 350 National Guard personnel called out throughout this time. They're playing really important roles, whether it's in testing or the lab work or in supporting those that are on the front lines. We want to say thank you to all of those fantastic North Dakota Guard members for the great role that they're doing, and thank the White House for extending the Title 32 through the end of December. The closing gratitude quote for today, French novelist who died in 1922, Marcel Proust. I'm sure many of you are familiar with that name. And one of his most famous quotes is, "Let us be grateful to the people who make us happy. They are the charming gardeners who make our souls blossom." I thought it was the perfect quote today because we're grateful to all those people that are sending their seeds in versus planting them. And so if you're, again, you'll make us happy if you're being a charming gardener but not planting the unwanted, unsolicited seeds. So keeping North Dakota safe that way. So again, thank you all for tuning in today. We'll be back next week. Our press conference, press briefing is going to be Monday at 3:30 p.m. And so until then, remember to continue to practice healthy practices for you, your family, and your community. And we'll now stand for questions. I think the first hand up today was Jacob, and then we're going to go back to online next.
Governor, last week you said you wanted to hit 8,000 tests per day. Wondering what the latest on those efforts are.
Well, we had many hours of discussion about this morning, and we've got I think a solid plan on how we want to move forward. But one of the things that I think is clear when you take a look at testing in North Dakota versus other states, in most states the state lab is doing less than 20% of the testing. In North Dakota it's been 80% of the testing, and part of that is related to the fact that we had no commercial labs in North Dakota, where many other states have multiple commercial labs. And I think that you've asked a question, Jacob, about quantity, but I also want to extend this answer to talk about quality, because quality also relates to timeliness. And us doing 8,000 tests and getting the results 3, 4, 5 days later, that wouldn't be as helpful as us doing less tests and getting them within 48 hours. So we're at this point where it was really a quantity battle early on to build capacity. Now we need quantity and quality, and by quality I mean high accuracy and fast turnaround and notification, because if somebody takes a test and it's 5 or 6 days before they find out, either they've missed a week of work for nothing because they were isolating, or they say, I'm going to keep doing what I'm doing until I find out my result, and they may be an asymptomatic spreader. So in those cases, the latent information of a test does not help us. So we've got everybody that's been involved with the lab has done amazing stuff. We've went from sort of a 200-day test operation to 5,000. That's a 25-fold increase. I mean, there isn't any piece of government that's been asked to do 25 times as much. I mean, the closest might have been job service when we were, those in early days of this. So the gratitude, again, National Guard, the lab team, everybody that we've worked with, but we've still got work to do. If we want to get from 5,000 up to 8,000, we've got to spread the labor pool around. And again, this is going to involve the NDSU veterinary lab, stepping up as part of this back to school. We had discussions this morning about how do we get UND, sort of onto the playing field as another lab partner. And again, the private sector may have to play a role here, whether that's in-state or out-of-state, in terms of partnerships, in terms of picking up capacity for us to do that. So it's going to be a broader set of teams that's going to get us there. The state lab alone won't get us from up to 8,000. Physically, we don't have the people or the space right now in the current constraints of the lab. The follow-up question?
I recall not too long ago there was an agreement where North Carolina lab was helping us out a little bit. Anything like that possibly coming back?
Yeah, and Mako is the name of the company, MAKO. We're off to a great start with Mako, getting excellent turnaround times, and we're using them. Last week we had a little bit of a hiccup, and I think that was some of that was on us, not on Mako, in terms of us sending them a set of tests that came from a drive-through versus surveillance testing. Mako's got they've got a great portal and a great website. So if we say we do 1,000 tests across long-term care, and the people that really have to access that 1,000 tests might be 10 hospital administrators as opposed to 1,000 individuals. Those 10 hospital administrators would become familiar with how to access the Mako website, and they could go and they'd say, okay, the sample's been received, the sample is in testing, now the results are posted. I mean, they show all of the progress of the test, so that when people, without that, people are calling, is my test done? Is my test done? I mean, this takes care of a lot of that because they've got the software infrastructure to support that. And so that's a plus. So again, if we continue to use Mako for turnaround, and then again, instead of calling, people can get notified electronically. They can just look on the website. A hospital administrator might be able to take a look at the whole batch of, hey, here's all the tests that ran here. It could be very, very, it was working for that. So we want to keep using it for things like surveillance testing and long-term care. We'll use Mako for that. Preserve our state lab capacity for doing diagnostic tests in North Dakota. So if somebody presents here who's symptomatic, we can get a fast turnaround for them of somebody that might be mobile and we know where they're going. So part of it's how we allocate our resources. The turnaround times also is not just the actual people that are doing the tests. It also has to do, again, with IT systems where there's so much manual re-entering of data across all the different information systems that we have. And we've engaged a team from our NDIT team. They're meeting with the content experts from our own lab, and we've got to work to be able to streamline that. And I've asked the group this morning. I just said, look, I mean, we want to know almost like on a color chart of a test that comes back in 48 hours. Let's call that a green test. One that's 48 to 72 might be yellow. If it's over 72 hours, that starts to become less valuable. And if we're paying the same amount of money for each of those tests, but some of them we don't get the results for 5 days, we're not getting our money's worth. So we've got to take a look at every aspect of this business process and engineer it down to make sure that it runs smoother in terms of high quality. This is really important, and I'm appreciate everybody that's digging into it right now, because we are going to have a increased demand on testing going into fall for K-12 and higher education, and we've got to get this part of it right. Okay.
If you could just describe, are there problems with turnaround right now?
We had some of the ones that went from the drive-through testing that got sent to Mako. The times were not acceptable to me, and they weren't acceptable. We had a few emails and calls from people that said, hey, I've been waiting 4 days. You know, I got the test on Monday. I didn't get the result till Friday, you know, that over the weekend. So I don't want to hear from the citizens that they're having problems. I mean, to me, that we want to have reporting systems internally that would tell us if we're slipping below this 48-hour goal that we want to have. Okay, online.
Mike Smith, 660 KUYZ in Williston. Over the weekend, a Trenton clinic held a testing event where they saw over 500 tests administered. They've heard reports that the clinic incentivized the event by giving out over $600 in gift cards. Do you feel this hinders the testing numbers, given the way North Dakota reports their testing rate?
I don't know if locally they made a decision about incentives or not. I know this was had been some discussion by some of the tribal nations before, and maybe by some local public health units, but when we're doing large testing events like that are surveillance testing, then we want people to show up. And so if there's if they felt incentives was required, you know, that sounds like 500 people and $600. I mean, what is that? You guys can do the math on that. Is that $1 a person, $1.25? I don't know if that's going to be I don't know if that's going to influence whether people show up or not, but if it was, you know, $10 random drawings or something, win a gift card, come and get tested, you might have a chance to win. I think it's important, particularly when for people that are asymptomatic that may feel they don't need to get tested, that when we're trying to do surveillance testing, we need people to show up. So that's maybe a good thing, but it wouldn't affect our data. We're interested in people, whether they're have symptoms or don't have symptoms. That gives us a sense of whether it's where they are in the where the prevalence of the spread is. And I think we're now, you know, through the testing we're doing in places like Trenton, we now know that the COVID exists in, I think, in 48 of the 53 counties right now are reporting at least one active case. So it is widespread in our state, and we got to continue to do surveillance testing. I'm going Amy, and then Jeremy, and then Tom will come right down the line.
I have 2 questions about the Burley Morton task force. First, is there a funding source that's been identified to fund it in a dollar amount? There's not a dollar amount that's been identified, because I don't think we know what all the resources are needed. The folks that I identified that are on this are all working in their current capacities, whether that's in public health or the state of North Dakota or as the mayors, et cetera. So there's right now, I believe everybody that is joining this is doing it in their current leadership capacity. If that group identifies that they need sources for funding like say additional testing or testing routines, then those dollars could come from the money that I just talked about at the beginning about the coronavirus relief funds and the money that we were putting into contingency funds for the North Dakota Department of Health. Again, allocating money towards public health, but not exactly knowing where in the state we may have to direct those dollars, but it would make sense that we'd be directing dollars to the places where we have the most number of cases. So I guess on that one, Amy, we just keep you apprised, but there was not an upfront dollar amount identified. Okay. And then one other question. The slide identifying the various members of the task force, there was a steering committee, and then there were also people listed as members at large. What's the difference between those?
Well, I think of the steering committee as a group that you might think of that as a leadership team, where if we've got to get a smaller group of people together during an emergency to move quickly, but they want to get input from members at large, and so other people were named. And then as I went through the talking points, I described 5 separate committees, subcommittees, and those are each going to be staffed with people. So as it was in Cass Clay County, this ended up becoming a large number of people, but it's a large number of people to get together on a video conference when you're trying to make decisions. So I'd say that think of the steering committee as sort of a leadership team that would help guide this and interact with the state.
My questions are for Chancellor Hagerott.
Okay, thank you, Jeremy. Chancellor Hagerott, you're up. I'm thinking you want to ask one to Erica too. Maybe she should get in the queue, right? So
get ready to go. Erica, Chancellor.
I'm just trying to clarify some of your comments with what we've gotten in emails here about the testing plan. So you would like to see students get tested before arriving on campus, but I think you just mentioned that they will be able to get tested on campus as well. So I'm just wondering what the preference is.
Right. Thank you. What we basically have is a surge of people coming, and you know, as a former military guy, there's just lots of parallels here. You know, there's a surge of people coming, and you want to make sure that something doesn't get in the gate. Now, some will, obviously, right? So if we have testing, and if they find they're infected, we'd ask them to stay at home until they've recovered from this, because the governor said many people are asymptomatic, don't even know they have this. So that initial wave of testing, by the way, this has been endorsed by Dr. Carson from NDSU, Dr. Wynn, and Dr. Fauci just came out and said, yes, this is important to have pre-testing before you return to campus, and I can give you the link of that national reporting. So that's the initial wave, and there's a big wave coming, right? Tens of thousands, okay? Then there would be testing, you know, on the campus, kind of just, you know, monitoring what's going on the campus. It's kind of surveillance testing if something breaks out. And so between those various things happening, and then of course, when we have the social tracing, if someone's been infected, then you social trace. And UND is already seeing good results of that. They had someone test positive on one of the teams. They then did the social or the contact tracing. They immediately isolated, 12, 13 people, and sure enough, 6 of them had it, but it didn't spread anymore, and they got it knocked down. So each one of these things are a step to knock things down. And again, the blessing is these are generally young, healthy people, but we're trying to prevent, as what Ms. Solberg said, further spreading this that puts older faculty and staff at risk in the communities there. So that's the nice thing about this, if there's anything nice you can say in the university setting, is we have generally a young, healthy population, and they're trying to protect other people. And that's what we call on them to, you know, like she said, she's very proud of them, how they did before. We're asking them again to take this, you know, challenge. Does that help?
They should try to get tested in their hometowns, wherever that may be, and then again on campus?
If they just got tested, you know, before they came and they're good, then that's fine. But there will be testing. Again, these events go on right up to when they begin to arrive. And so if they have some reasons, like they're starting to have some symptoms and they're not feeling that well, you know, those tests will be available there.
Follow-up, I guess.
Sure.
I understand that this is a strong recommendation that people get testing, but not a requirement. I'm wondering why it wouldn't be a requirement.
Well, I can tell you as a former Navy guy at Annapolis, it's a requirement, okay? The parents don't get out of the car, you get tested, you stay in your room, and when you're clear, then you come out. But that's called a military organization, okay? And so we're not that. And that's why we rely on the students to rise to the challenge, and that's why we're trying to make some competition out of this, healthy campus competition, because there's obviously a downside if we're a police state, you know, and we're not that. So you know, we don't want to, you know, back into something like that by making these strict requirements. I see that generated more questions now. He had his hand up first. Jacob.
Chancellor, you mentioned monitoring testing on campus. What does testing protocol during the school year look like?
Well, we're still working through some of that. Obviously, the big challenge is the initial surge that's coming. But for example, I think one of you just reported that, you know, NDSU is about to come out with, you know, what does it mean at the Fargo Dome? You know, because they have big urban area, 350,000 people, I think, more or less in the Fargo-Moorhead area. Whereas in Botno or like Valley City, I went to a football game last year, you know, open air field, you know, you social distance, I guess, is the testing could be less demanding there. So I would ask you to probably reach out to campus if you have specifics, because it's quite a different range from Botno, you know, to NDSU. Yes, Amy?
What are you advising students who live out of state to do? I mean, if they can get tested in their home state, do that. or come to campus and get tested right away? What are you thinking?
Well, it would be nice if they got tested at home, but again, the generosity of our state and VernDOSH, the Department of Health, and our government is we're going to provide tests to all those students that come in, the Minnesota students. And the campuses are doing a really nice job. They are actually many of them are setting up times that you arrive to move your stuff in. Like I got to know from Dr. Bershani that students are coming in, dropping stuff off ahead of time. Then they'll come back and actually roll in later. So we keep reducing the density. Remember, that's the key strategy, is reduce the density of this as much as we can. So yes, there'll be testing available for Minnesotans and other states as well. Yeah. Oh, sorry, I kept looking over that way. Yeah.
April Baumgarten with the Forum of Fargo-Moorhead. The CDC does not recommend entry testing for higher education students, saying it's unknown that it provides any additional reduction to transmission beyond what would be expected with other preventative measures. Minnesota has also advised its colleges not to do mass testing for students in fear that it would take away resources. What's your response regarding those concerns as we move to test students in North Dakota?
Well, that's interesting. I'd like to see, the latest CDC update on that report, because I just read this last night where Dr. Fauci said, and my guess is probably a cost-benefit analysis. If you're a state that doesn't have as robust testing as we have, and some of our neighboring states are way behind, then of course, if you can't offer it, you probably go to point source. People who are right here, right now. But right now, knock on wood, we have a fairly low level of demanding on the tests, and the NDOH, Department of Health, can help us on this strategy. So I think if we looked at the details, of course, if you have the capacity, it'd be nice to do testing before they get there, and then testing when you're there, and periodic serial testing. That's, I think, probably what they would be getting at. But I'd have to look at exactly what CDC said. And Minnesota's point is, obviously, they're very strapped for resources, I think, compared to us, relatively speaking. So I think that's probably why they did that. But I'd have to look at exactly what they wrote. Sure.
Sydney Mook with the Grand Forks Herald. Are you expecting there to be a rush in testing just before August 24th when classes would begin? Because they would be more accurate testing closer to than testing now?
Yeah, I would anticipate that. And again, the Department of Health is being very strategic. They're not just helping us, but they're helping the community. It's just that students will be given preference as we get closer to the time when they arrive. So that would be my anticipation too, is that students, as they get closer to actually getting on campus or when they arrive, like, for example, from out of state or Canadians, they'll do it when they arrive. Yes. Should I keep going, Governor, or am I taking too much time here?
Question for Ms. Solberg.
Oh, okay. You're up.
Would you feel safe taking a normally attended class in the fall?
I definitely would feel safe. I'm going to attend classes in person when I go back to NDSU. NDSU specifically, I can speak on behalf, has done an excellent job outlining the kind of procedures, safety precautions that we do have to follow, and many of my professors too have reached out and shared some of their plans. But at any time, if I don't feel safe, I feel very confident that I can still get the same educational value online.
Thanks, Chancellor. Thanks, Erica. Other questions? Amy, and then online, and then Tom? Or have I not gone to Tom yet? Okay, we'll go to Tom first, then Amy, then online.
One of my questions about schools and the reopening process. One superintendent of schools told Coyote News in the last 24 hours, "I'm expecting a full-blown distance learning platform by Labor Day. I hope I'm wrong." And then District 8 in Williams County has put forth a plan to close all schools if they have one positive student test for 10 days. Are you foreseeing some real trouble ahead?
Well, I think what we're seeing is that each school district has got to have their own
their own plan. I mean, we talked about this when we launched it with Superintendent Baszler. They've got to have a distance learning plan approved with the state, and they've got to have a health and safety plan approved and sitting with the state. But then when they get into the school year, local school board will be making those decisions. And if their approved health and safety plan feels that if they have one positive case, I would think that would be by a building, not by, because I know that District 8's got, buildings spread over large geography, that if they had a case in a building, then they'd make the decision on whether they want to close a classroom, close the whole school, how they want to do it. But I wouldn't think that they would be closing all of their buildings with one positive case. But again, that'll be a local decision. Parents will get a chance to interact with their local school boards about how they want to do it. And if they've got their distance plan in place, if a building is closed, then they have a requirement to switch to doing the distance learning as part of that.
First of all, by way of clarification, the president of the school board told us that they would close all 3 buildings for 10 days if they had one positive test. That's part of the plan. The question I have is a more personal question to you. How do you feel about opening the schools with reports like this? Do you feel comfortable with opening the schools? Do you feel like the children are safe?
I feel like the children are safe. I think that I think I said something. It's if you're, for young people, this is like a 1 in a million, risk of death. I mean, there's risk of getting sick, but there's risks in life. The real place that each school district is going to have to take a look at is, do they have any faculty or staff, teachers in a K-12 setting that have either age or underlying health conditions that make them someone that would be in a highly vulnerable category, because those are the folks that really have to be protected. So we've got to figure out a way to protect those that are vulnerable. And when we talk about saving livelihoods, we can't have a generation of school kids that are missing out on their education. And that education's got to be provided as best it can be during this time frame. And sometimes you need a building to assist in that. Sometimes you can have a great education in the outdoors, sometimes a great education online. But I think this is going to challenge all educators to think about, how do we keep education moving forward? And if we can do that, it gives a chance for educators, for school board members, and for parents, and for everybody to teach our kids a really important lesson, which is there's times when you have to innovate, there's times when you have to take risks, there's times when you have to come up with new approaches and new business models. And this isn't about, oh, shucks, we can't do it the way we've done it the last 120 years. This is about, let's grab this opportunity to figure out a way to do it, better and differently going forward. So, and I think we're going to see across our 175 school districts, I think we're going to see some highly inspirational approaches and outcomes. And I think on some other ones, sadly, we may have folks that just say, wow, we don't have a building, we can't teach. We're teaching our kids something that we need to teach them a lesson that as adults that we can overcome these kinds of challenges. I mean, education was happening in this planet a long time before we had 450 taxpayer-built school buildings in the state. I mean, a building is not the end-all, be-all to creating an education. Anybody that's spent any time with a role model, a mentor, a coach, spent time with a coach on a field, you're not in a building. You're learning all kinds of things. So I think we just have to remember that when we as adults have an opportunity to teach every day, every place, as well as on we can deliver information online, on any device, any time of day. I mean, we just got to let go of some of the constraints and understand how we can move forward. Okay, I'm going Jacob, and then do you have some more stacked up over there too? Okay, all right, we'll go Jacob, online, then Amy.
As a follow-up to Tom's question, it was your order that shut down schools back in March when case numbers were in the single digits, and now the active case count is over 1,000, and you feel like children are safe in schools. Where's this change in confidence coming from?
Well, part of it's data-driven. We've got data by states, by the nation, by the global. I mean, we've got so much more experience about the sort of the health course, the risks for different age groups, the treatment approaches. We got a handle on our testing. We got a handle on our healthcare capacity. I mean, we had so many unknowns last spring, and there was a lot of assumptions that had to be made at the time on in terms of being cautious about people's lives when we didn't know the outcomes. We know so much more now. We've got so much more capability now that I feel very confident about our ability to enter back into education with healthy young people. If you've got a young person who's got underlying health conditions, someone who's going through a battle with cancer, some kid might have had to draw the genetic, card where they have cystic fibrosis, there's going to need to be special empathy and accommodations because there are young people that are at risk for this. Unfortunately, it's not the vast majority of the population, but those school districts are going to have to be aware of those situations. They're going to have to be looking out for vulnerable students and vulnerable adults as we move forward. I'm going to go to Amy, I promise, next, and then we'll go there. Amy?
Changing the subject a bit, we've noticed that there's been an uptick in active cases in Stark County, and it now has the third most active cases in the state. Are there any particular factors that are causing cases to rise there?
It's another county that we're paying close attention to when they pop up like that. And again, because when you see on some days where you've got case counts that are at or above, say, Cass County, and Cass County had a day went down in single digits, and yet they're our largest population county. So we are paying attention. We don't think we're at a point yet where we need to create a task force for Stark. Contact tracing is not revealing anything specific. It's, through a broad range of interactions with, people working, people going to events, people going shopping. It's kind of popping up, here ones and twosies. There's no particular large event that we can point to for Stark County at this time, but we're going to keep close eye on it. I'm going online, then I'm coming back over here.
Scott WZFG at KFYR Radio. Do you agree that the more we test, the more cases we'll find? And if so, are we still learning something we didn't know? And at what point do we know all that we need to know from testing?
Well, yes, Scott. The more we test, the more cases we'll uncover. But when we're uncovering a disease that is asymptomatic, that's a good thing, because then we can ask the people that are spreaders to isolate until they are not a spreader anymore, and that's the way that we can, save lives and livelihoods. So the testing is really important. I think the key for us is, again, not just looking at the absolute numbers, it's also looking at the percent. And 2.5% for the last 7-day average that we have is again among the best in the nation. We're in a very good spot for us to be in a position to add some risk back in the system. That risk meaning opening schools, opening higher education, keeping the status where we are in the green status with the low risk status. All those things are good indicators for us as a state, and so it gives us confidence to keep moving forward. So until there's a vaccine, testing is going to be an important part of us making decisions, because it's the one way that's going to allow us to effectively gauge risk. Okay, Jeremy, then Tom.
I wanted to ask you about the outbreak on Spirit Lake. I'm just wondering, what is sort of your working understanding of that outbreak and how it's progressed to this point?
Well, I would say that the understanding is still unfolding, because the contact tracing from the positives that were uncovered from last Friday's testing event, we're still doing the contact tracing. But I would say, again, it's I would just call it life. It's everything from basketball camps to to daily living. There was a few that were tied back to the casino. Which again is a source of where people might be gathering, even though we know that all the tribal casinos are doing a great job on protections in terms of spacing and disinfecting. But these are the things that happen. And some of it is I'm going to say big box stores where people might be shopping. It's a sprinkling of everything. We don't have any one particular event there either, but we do know that a number of the number of the cases that came up were asymptomatic, which again is great if we're uncovering asymptomatics, so then people that, hey, I didn't know I had it, now I can change my behavior to protect the elders or those that are vulnerable in the community. So again, we really appreciate the collaboration with the tribes, and all of them have been. I think this is the third large testing event we've done with Spirit Lake, and it's the first one where we've had a kind of a cluster of cases emerge. And so, the first two were great because we found out that we were, things were was less spread. On this one, maybe a good early indicator.
On that, there have been other Native American reservations in other parts of the country that have experienced really severe outbreaks. What is the state doing to prevent that here in North Dakota in terms of providing resources? I think you had mentioned providing masks to Spirit Lake in this case.
Well, I think one of the things we're doing is we've been collaborating with the tribal leaders and the tribes with which we share geography since the start, and that has been particularly the collaboration around large testing events has been super helpful, because it's events like this where we can, find out we had 33 active cases from last Friday, as opposed to, next week, having 100 or 200 people show up that are sick. I mean, that would, this is proactive. The proactive collaboration around testing is what allows us to arrest the spread of this thing quicker. And so that's number one. And then number two is just, again, working with Chairman Yankton and whatever they need. And both the federal government, Indian Health Services, state of North Dakota, we can work collaboratively as a team and say, do they need, in this case, masks seem to be one thing that they could use more of. That'd be one thing to, keep working together on. Tom, and then back on this side, if you got any. Tom?
Follow up on the schools. Sorry, I can't let that go. I keep getting texts. One of the officials with the school district said to me, I like our governor. I want to make sure that there's no disconnect between science and personal preference in relation to opening up the schools. Now, Dr. Fauci said over the weekend that there is no study currently available that gives us data that shows what effect COVID-19 really has on children. In fact, he said that there won't be a study available with usable data till November or December. So the question to you, Governor, is where's the beef? Where's the science that you're relying on?
Well, I think that it is an absolute fact that there are many unknowns that we have around this disease. But with the information that we have available right now, I'm confident that we can proceed forward as we have. But if an individual parent, again, the ultimate decision maker on whether a student goes to school or not is a parent. So if a parent is uncomfortable and wants to wait till they think there's more scientific, conclusion about whether or not their student is safe in a school, then that's a parent's choice that they can make to do that. And we respect that right. And I expect that we may see more incidences of people either choosing to do distance learning or choosing to do homeschooling on their own. This year, I'm sure we'll see more of that, because different parents, based on their own child's health, can have different risk assessments. But I'm comfortable about the plans that we have, and I'm confident that our local school boards will be making good decisions. Online, last question.
Jemp with Hometown Radio Group. The Department of Health has spoke about releasing a breakout of positives from serial tests versus unique tests. Right now, it's not released in the daily releases at 11, but it is released by the Department of Health within the comments section on Facebook. Why can't this breakout be officially released during the press release at 11 a.m.?
I don't see any reason why it couldn't be. If it's public data, then it's just a formatting question. So we'll, if we can make it easier, I've got a few of my own suggestions on the 11 a.m. Report. I think we're talking about some other upgrades to that report to keep what we have, but add a few things to it. So thank you, Gene, for that suggestion. And with that, we'll say again, thank you all for tuning in, and thanks for the live audience in here. Thanks for the media that participates online. We appreciate all of your questions and all of your input, all the effort you do to communicate about this. And in the meantime, stay healthy, and we'll see you next Monday at 3:30. Thank you.